Right. We're getting some more people coming in. Hi, everyone. If you're just joining, it's just a minute or so after 6:30. We have a good group registered tonight. So I'd really like the opportunity to let a few more people log on. I'm just going to give it a couple more minutes and then we're going to get started with a formal welcome, a couple announcements, and we'll kick off our presentation for tonight. I see more people coming in, which is great. We're just giving it another minute or two. We're so glad you're all here. Thank you so much for being here. Um,
Yes, apparently I
you're
goofed up.
here five.
Yeah.
Wow, you're here like four times, Miranda. How does
Yeah,
that
and
work?
it's so funny. Someone called and was like, "Oh, I got an email from Miranda Press." I'm like, "Oh, well, that's me." But now I'm like, apparently I goofed something up, and now there's a bunch of
All
Miranda Press.
right. Yeah. Well, if you are logged on and somehow you have managed to log yourself on as Miranda Perez, welcome. We are, we
Yes.
are, yeah, we see that she's on here a bunch of times, but that's okay. We're glad to have everybody on here. I'm going to go ahead and get started, I think, with the just a welcome and announcements before I introduce our speaker tonight. Hopefully, a few more people will hop on live. Evelyn, let me ask you: Is it what's works best for you? Do you like questions? Do you want to take questions as they might come up throughout the presentation, or would you like for us to save them to the end? Miranda and I can monitor them, so if there are any through the chat, we can handle that.
As much as I wish I could answer them like during, I'm not like the best with Zoom yet, so maybe towards the end. So yes,
That's totally
okay.
fine. That's totally fine. And actually, in a lot of ways, that works because, sometimes answering questions, especially if you are doing a slideshow and stuff, can kind of interrupt the flow. And it also can end up, if we talk a lot, it ends up kind of running things late. So just so everyone's aware, we're gonna save questions to the end, but you don't have to save your question. So if you have a question and you would like to drop it in the chat, we will make sure that we check the chat and then we will do a Q&A at the end. Okay.
Yep.
And
raise your hand and we'll get to
oh,
yeah.
perfect.
Yep. Well,
That's great. All right. So that will work too. You can raise your hand and we can do it that way. And just a couple of reminders. So this is a monthly series. If you have never joined us before, the Breast Cancer Network of Western New York hosts this learning series on the first Tuesday of every month. It is sometimes in person. Tonight we chose to do Zoom only, but we do sometimes also offer an in-person option. So always check to see if that is happening, if that's available. But it's first Tuesday of the month at 6:30. Our next one will be Tuesday, April 2nd, and it will be actually one of our own board members who is a breast cancer survivor, as well as who works at Great Lakes Cancer Care, overseeing the oh, sorry, all my mind just went totally blank. Miranda, what does Melissa Wanzer do at there's the word and I can't come up with it. Well, she does a lot of things like this, like patient experience and programming and survivorship support. That's what I was trying to come up with. So she will be, Melissa Wanzer, who is also a professor, will be speaking on the use of humor when you are facing, as like a coping strategy, when you are facing challenging experiences. I know personally, I have used humor to do a lot over the years to deal with my own breast cancer diagnosis, and I think it will be a great topic. So hopefully, you'll be able to join us then as well. And otherwise, always remember that we have weekly restorative health classes available at the Breast Cancer Network that are free to anyone who's been touched by breast cancer. And then other than that, for events, we have our next day of renewal this Saturday. It will be held in Fredonia. It is a lovely workshop retreat day. It's a chance to come together, and we will have a Reiki workshop, we will have a therapeutic art workshop, and we will have a flower bouquet making workshop. And it's 10 to 2. And it's really just a nice chance to come together with people who understand what you've been through, or what you are going through. But we really focus more on living and less on cancer. So it's more of a social opportunity, but still a chance to connect with others within the community. So that is this Saturday in Fredonia. We will have another day of renewal along the same format in early April. I think it's April 8th, I believe. It's the first Saturday in April. And that one will be in Ellicottville. So you can get all the details about that and register for free on our website. And keep an eye out for emails too, because those typically come out. But I think that's all I've got to get us started. I think it is a good time to get started. So I am, in case I've met you before, my name is Amy Hartle. I am the current president of the board of directors for Breast Cancer Network of Western New York. I'm also a breast cancer survivor, and I'm an oncology, massage, and lymphatic drainage therapist here in Buffalo, working with the breast cancer community. So I spend a lot of time in this world, and I'm so grateful to our speaker tonight, because this is a topic that I have been interested in sharing for a while. Our team has been interested in sharing for a while, but this is the first time in our learning series or in our workshops that we have actually had a tattoo artist come to speak. And clearly it is a topic of interest, because we had a great registration turnout and a great group on the call tonight. So I am actually going to let Evelyn handle her own introduction, because I know she will do it better than I could. But Evelyn Bellreng, thank you so much for being with us tonight, and I'm going to turn it over to you.
Thank you for introducing me, Amy. Hi, everyone. I'm Evelyn. I've been a tattoo artist for almost 6 years now. And since I began tattooing, I wanted to find a way to help others. I don't know what it was that kind of called me to wanting to help people, but I just wanted to learn as much as I could about tattooing healthy skin and skin that's been compromised or touched by other circumstances. So I started off in the traditional tattooing sense, learning a lot, and I slowly learned more as I went over the years. So what is paramedical tattooing? Also goes by restorative tattooing, and restorative tattoos, paramedical tattoos, they are just what they seem. They restore a person's appearance and confidence in many ways. For example, eyebrow tattooing can give the illusion of fuller brows after hair loss. The same can be done on your scalp. That's called scalp micropigmentation. There are a few other examples. There's the realistic areola restoration, and that could be for women or people who have had breast cancer or gender reaffirming surgeries. Also, there is skin camouflage that can help people who have lost pigment in their skin for a multitude of reasons. It goes even as far as tattooing a realistic belly button on somebody. So the realm of paramedical tattooing it's gone from realistic tattoos to this new new chapter of medical tattooing that's really helping others. So I didn't want to start the presentation with areolas right in your face, but this is a few examples of some areolas that I have tattooed on fake skin, for an example. You can do a lot with just shadows and contrast and just building up those values to give the appearance of a 3D areola. So I kind of went over this already, but paramedical tattooing has a few names: restorative, reconstructive, post-surgery. You might hear those terms a lot when you are at the doctor's office possibly, and you're looking for more information about this. And all of this knowledge came from, surprisingly, the permanent makeup industry and the traditional tattooing world. They kind of, although they were separate, they obviously had a lot of commonalities. So the knowledge kind of overlapped, and here we are today. There is a lot that can be done. So if you didn't know, back in 2021, there was the Comprehensive Breast Reconstruction Act was passed. So it's a law in New York State, and it mandates that areola restoration be covered by your health insurance if you're lucky enough to have health insurance. And it falls under the umbrella of breast reconstruction. So there's medical coding and everything else that can kind of help guide you through this, although health insurance companies, we all know that they can kind of give you the runaround. But you as a person have a choice to decide who marks your body. You shouldn't have a stranger marking you with something permanent that you have never met. You don't know what their experience is. And I've heard stories of women or breast cancer survivors who are underneath the knife. They get reconstructive surgery after breast cancer, and someone, while they're under tattoos areolas on them, but they're not sure who's tattooed them. So I find that a little alarming, and I believe everyone should have the choice to choose the artist. So when you are in a situation like this, looking for someone, obviously you gotta ask questions. You have to be your own advocate, and don't let the insurance companies confuse you, give you the runaround. And if you want any more of this information, there is the link that goes over more in detail about this really important law that was passed. All right, so is a restorative tattoo right for you? Everyone's path is different. Some people fully embrace marks and scars on their body, and they are happy to tell their story without any pause or hesitation. They are just happy to share what they've been through and that they're a survivor. Others want a sense of normalcy, a little bit of their confidence back, and there's multiple ways to do this. This is an example here. On the left, you'll see an areola restoration tattoo that I did on a woman who's a breast cancer survivor for over 20 years. She had one mastectomy only on one side, and she still has one breast on the other. So I matched the areola. So the one on the picture on the right you were seeing is the healed version of the picture on the left. So it healed really beautifully, and Now, although she said she didn't want to, she's not in the world of taking her clothes off for anyone anymore. She's a little bit older, but to give her a little bit of sense of her femininity back and gives her a little bit of what she lost back, that was sort of invaluable. So it was very meaningful for her to even have come to me to do that for her. I've also had people come to me for more decorative tattoos. And decorative tattoos is just a fancy way of saying your old school tattoos that you see decorating people's bodies. This gentleman here, he's into, you know, patriotism and everything else. So he decided to get a flag over a scar that grazed his whole shin. So his story, without getting too into it, he was to the point where he didn't like wearing shorts. He didn't want to show his story, and he felt uncomfortable showing his scars. And he, in the heat of the summer, would not wear shorts. So through tattooing, we were able to give him some confidence, and those were the first shorts he put on in so many years. And it was very emotional, and I was so happy that I could just be a little chapter in his story that he could gain a little more confidence from and actually be comfortable in the summer, because who doesn't want to wear what they want to be self-conscious about what they're wearing? It's awful. All right, so here are a few more examples of the decorative variety. So the picture you see on your left, Grace is a lovely lady who suffered from self-harm scars on her thigh, and we turned it into a tattoo that you are more drawn to than the scars on her, and she no longer has to feel any insecurity over what her past may have brought her, and she can tell the new story. And the picture on the left is a tattoo that braces. It was a tiny little scar. This woman didn't have full breast cancer. She just had a small dermatology sister moved there, and she just wanted it covered in a beautiful little graceful way. So I'm sure lots of people have this question. This is the question. If I get any question, it's this: when can I get a tattoo? When can I get tattooed after all these experiences, after all the doctors? So a scar, if you have one, or any sort of medical trauma in the area, it should be about a year healed. There is some differing opinions on that, but personally, I have seen the best healed tattoos on people whose skin in those areas are healed for about a year. The more complex the trauma in an area, the longer your body needs to heal. Every person's different, and everyone heals at a different rate. So if your body is still sensitive, if you have a scar that is still itchy, you may want to wait. Your body will handle the tattooing process better. You'll be more comfortable during the tattoo process. And also, of course, you have to make sure you're cleared by your doctor. And your doctor may clear you at 6 months. That's a very common one. Some people would tattoo you at 6 months, and I'm not trashing anyone or anything, but I've just seen certain and done certain tattoos that have led me to the 1 year opinion. I'll tell you a story. So I had a woman who she wanted a very small cross on her collarbone. She had a small in-office dermatologic procedure where they removed a cyst, and she didn't tell me. So the worst thing that can happen is when a tattoo is healing, is the ink spreads underneath the skin. So because she didn't tell me and I tattooed her, the worst thing happened. The ink flew out. That's what they call it. The ink flew out. Um, we were able to fix it. I was able to use, after a few sessions, I was able to use skin toned pigment to conceal the blowout. And the first touch up session for this cross tattoo, she lets me know, yeah, I had a small in-office procedure done here. You think that might have been the cause of why the tattoo healed this way? And that was it. So, and I want to say she had that done roughly 6 months prior to that small little cross tattoo. So although it may seem small, insignificant, like it's just a small tattoo. That's why I err on the side of caution and try to tell people maybe wait a year at the very least, just to prevent anything like that happening. Because no, I'm sure someone somewhere knows someone with a tattoo that has ink that may have bled out or blew out underneath the skin. It doesn't look the best, and it's hard to fix. So, erring on the side of caution with letting things heal, it's always better. Although impatience, I completely get that. If you're wanting to move on with your story, putting a pin in it and getting a tattoo, it's such a huge way to mark a new chapter in your life. So just try to have a little bit of thought and patience when you're at that level. Okay, and a little bit more about me. So I've been tattooing for 6 years. I went to Buffalo or UB. I got my bachelor's in fine art. And then about a month after I graduated, I was taken on as an apprentice, and tattooing became my life at that point. So I learned, and when I started tattooing, I tried to learn as much as I could about tattooing over all types of skin, varying skin tones, skin that has experienced a trauma of all kinds, and just wanting to know everything I could so I could handle any client that was sent my way. That learning is knowledge, obviously. So I wanted to try to have anything under my belt that I could to be able to help anyone that came in front of me. I'm trying to think what else to say here. I'll get back to the Comprehensive Breast Reconstruction Act. So health insurance has a way of confusing everyone sometimes. And as a tattoo artist, I'm running into this as well because I'm trying to find more information on this myself as to how I can help more people in this predicament. Because sadly, breast cancer is a huge part in Western New York. A lot of people have been afflicted by it. So there are many people who would want to go this route and are interested in if my insurance will cover this, what kind of tattooing can be covered. So from my knowledge, I have read that breast reconstruction is covered for both breast cancer survivors and people who have gotten gender affirming surgery. Also, people who have vitiligo, they are able to get their skin camouflage to return to a more even complexion. And those are the only ones that I have seen that are covered by insurance. So when you look up paramedical tattooing, you may see multiple things come up, like eyebrow tattooing or the scalp micropigmentation, um, stretch mark camouflage. There are instances where people lose like a finger or um, they get a tummy tuck and they no longer have like belly button. Although like a belly button, a realistic one that was tattooed on, it would be very helpful to someone with like who just wants to look their best again. It wouldn't be covered under insurance, and those are the complications. So although it's paramedical tattooing, yes, Amy.
I'm going to go ahead and interject and ask a couple questions here, if that's okay with you, just because I think it's relevant. Cool. So one question is, thank you. This is really cool. I did not know that there was a law in New York State that stated that areola restoration is covered. I would be curious if, as part of breast reconstruction, so there's a procedure called a DIEP flap, where they take basically it involves it's a tummy tuck. They use free flap tissue from the body and bring it up to create breast mounds. So instead of using implants, and this can sometimes change, say, like the belly button, right? But it's all part of breast reconstruction. I'd be curious to see if at some point, if now or in the future, if a belly button tattoo would be included and covered, because it would technically be that surgery that erased it would be part of breast reconstruction. Do you have any familiarity with that?
As much as I wish I knew that exact scenario, if that was covered, I'm still going through all the bits of technical language myself because I'm trying to become as knowledgeable as I can about how I can be more help to people. I tell as many people as I can about this law though. That's
great.
That health insurance, as long as you have it, I know not everyone's lucky enough to have it. If you are, please look into this.
So we have, I was going to say, we have a question in the chat that I'll go ahead and ask now because it's relevant. So I think I know the answer, but we'll see if you have anything different to add. So someone shared that her nipple tattoos have faded to almost nothing, which can happen, right? We know that the tattoo ink can happen. And I think we see this more often when nipple and areola tattoos are done like by a nurse in a surgical office. I feel like it happens more frequently in those scenarios than it does when a tattoo artist, a dedicated tattoo artist is the one who does the work. But so hers have faded to almost nothing. And she actually had another surgery, which ended up leaving a thick scar. And the tattoo that I guess she had didn't want to color in the scar. So it didn't take the ink well, if I'm understanding it. And she wanted to know, or they wanted to know, would insurance cover having the tattoos redone? I'm guessing that would depend on her insurance. Is that correct?
Yeah, it would depend on her insurance, and I may be wrong, but they're probably going to be telling her no because it didn't happen immediately after the surgery. And that's when the complications arise, is for insurance companies to want to cover it. Someone is under the knife, they get the breast reconstructed, they go through all of that trauma in one sitting, that surgery. It's an umbrella of surgery, obviously. And that's when they have someone step in, whether it be a nurse or a doctor who may have some experience tattooing, and your skin's already healing such a major way that the last thing your skin wants to do is heal the tattoos. You're probably on
Right.
antibiotics and many other medicines. You wouldn't think so, but antibiotics actually can hurt a healing tattoo.
Okay.
It can either make the tattoo fall out, it doesn't heal well, or it can like sometimes what we call overheal, where it ends up looking a little more shiny and like scar tissue. So
Mm,
antibiotics and certain medicines have a huge impact on how tattoos can heal. And this isn't everybody. It's not every single case you see, but when someone is going through healing from a traumatic surgery like that, your body's not focused on the outward, like skin.
sure.
It's focused on trying to heal all the internal um, issues that have come up, and your body's going through a lot. So, but sadly, the insurance companies don't see it that way. They just say, "Oh, they're already under the knife. We're gonna streamline this process and have someone tattoo them, whether
Right.
it stains or not." So they're a little concerning, and it's very frustrating because
Yeah.
this person probably has, um, if they have raised scars, they can be tattooed over. Keloid scars can be tattooed over. And a
Wow.
keloid
Okay.
scar is a raised scar. Some scars feel flat. A keloid scar is a little more raised. Sadly, they're a little more prominent and noticeable. I have one myself on my arm, and it was such a turning point because I got it tattooed over myself. And I think
Mm,
because I had a scar like that on my arm in such a prominent place, that's kind of why my heart is kind of led me on this mission to help others who may have marks that they may be unhappy with on their body.
yeah.
So, although the person who asked the question, it may not be covered under insurance, um, if they are in a position of they've been healed for a long time, like at least a year, it may take 1 or 2 sessions to be tattooed over, and you can get your areolas restored again. Sadly, health
Okay.
insurance companies don't make that quite easy,
Yeah.
but it's possible for them to be tattooed again.
Okay. So the good news is that likely they could be restored, even though it's already happened. She's already had it done once and
Mm-hmm.
it didn't take. It's likely that they could have the person could have end up with a better outcome. The question is just would their insurance cover it? And that would really be something that you'd have to look into. That would be something that would probably it's probably not a blanket yes or no answer, unfortunately. So it's a great question, and I thank you for asking it. But you'd
Mm-hmm.
probably need to do a little bit of digging with start with your own insurance company, and then perhaps look into this particular act that Evelyn has shared, and we'll get the link and add it. You know, all of these recordings go up on our YouTube channel, so we'll make sure to put the link to this act, the actual website link for this bill into that information as well, so that if someone's interested in finding it, they can. There's another great question in the chat, but I'm going to hold it for a moment because I want to just see where Evelyn, what she might have next with her planned presentation. So I'm going to turn it back over to you. Thank you for allowing that interruption.
Yeah, absolutely. So let's get back to um, why someone would want to cover a scar rather than embracing their story. So I've encountered a multitude of people over the years, and honestly, um, everyone's personality is a little different. So I will see people who are all about telling their story, and they want to draw attention to the place of interest where they have had either a scar occur or some some surgery to. Others want to completely hide any visibility of what happened to them and just move forward. And each person's story is valid, and embrace, whether you embrace it or you want to just feel like yourself and normal again, is both a great reason to get a paramedical or restorative tattoo in the first place. There are obviously the different options. You can go for a realistic route, as simple as restoring your skin tone back to what it used to be. It does not have to be decorative or anything like that. Even if you have scars on your breast from breast cancer, and you just want those scars to look like the rest of your skin tone, it's doable. So the techniques are a little bit varying. So if you say someone comes to me with a scar on their body, we're going to try to match their skin tone. So a few pigments are mixed, and rather than the traditional shading, I would use little dots with a small needle, and I would what they call stippling the dots of the skin tone pigments into the skin over 1 to maybe 2 to 3 seconds to make sure there is a perfect match over the scar. And that's a more natural approach. And it's for anyone who feels like a traditional tattoo may not be right for them. And it's a completely good choice for anyone feeling like, I want to cover my scar, but I want to still feel true to myself. And then the more decorative tattoos that you see, those can enhance a scar or completely cover a scar. So here, I want to say his skin was texture wise. His skin was very, very pink still, although these scars were healed for over 10 years. I would say he had skin grafts over his legs. It was very extensive, and the texture of his skin wasn't what you normally see. And a few years prior to this, I had a client who had skin similar. She was a self-harm, growing from self-harm state. She no longer did it, and she wanted a tattoo over those scars. So her skin felt like crepe paper, and I'm not trying to diminish, I'm just trying to give you a visual. So her skin was very fragile, and the gentleman's skin was roughly the same texture. So I kind of used the experience I used on one client, and I grew to this other client here, where we did something completely different, with a lot of shading, a lot of color, and everything you see here. There were little dots. There was very little line work in here and little shading. I used little dots to create all the black and the red and the gray you see, to minimize the trauma to his skin, because it's already been through enough. The approach of using the dot stippling technique is it's gentle. So I could like run my machine at a lower speed, and as it graces the skin, the skin isn't as prone to bleeding or any excess. Because we don't want to see that. We like if the skin's already in a fragile state, we want to treat it as such. Yeah, Amy, go
Okay.
ahead.
Do you mind? I'll just
No,
figure out. I will ask a couple questions as we're going. That's fascinating. Thank you so much for explaining the method that you use. I don't know if anyone else who is on this Zoom now or will be watching this in the future has other tattoos. I do. I have a number of them. And so just learning that there's a different technique that actually sounds like it's, ideal for skin that is maybe has a different skin integrity, a different texture, a different quality, right, than other parts of the skin. And so I'm curious, did like a tattoo like this, I can see how dark it looks, and I know you mentioned this with the in the fresh and healed areolar tattoos. Do they typically take more than one session, or can you complete, say, like an areola in one sitting?
yeah, so let me bring my slides back to the areola here. So this was one. She only had one tattooed. So I want to say it took about an hour and a half. And it could definitely be done in one session. The healed photo you see on the right, that completely healed after no touch up. She lives out of state, so I would have loved to have her come in just for one more session, just for me to tighten up a little bit and increase some contrast. But super happy with how it healed after one quick 1.5 hour tattoo session. And the previous slide with the other gentleman with the decorative scar tattoo, that one took roughly 12 hours, and that was done in 2 really long, full day sessions. So depending on the person and what story they want to tell, whether it be more natural restorative appearance, or they want to go for it and go with a decorative way of telling their story or covering their body. There's varying time lengths to the tattoos, but for something like the areola tattoo, if a woman would want to get both of them done, it would probably take about an hour and a half for each one, so maybe 3 hours, give or take, for 2 dimples to be tattooed.
What's the healing process like? Do they require a lot of care? And so if someone's considering this and they're not familiar with tattoos,
Mhm.
what would the healing process look like after having something like, we'll go with the areola tattoo as an example versus like
Yeah,
the larger decorative, but
absolutely.
even
Yeah,
that, just in general, what does a person need to do to ensure that they get the most out of their tattoo as it heals, that it has
absolutely.
the best
So,
long-term outcome?
all right, so staying hydrated is absolutely key. I'm sure people tell you this all the time, but I truly mean it. So, in preparing for the tattoo, if you know you're going to get a tattoo, applying lotion to that area of the body beforehand, like 2 weeks prior, every day applying lotion and drinking lots of water prior to the tattoo, helps retain the ink more than you would think. And then also afterwards, moisturizing is key. If you don't moisturize a tattoo, especially after it's done, it will most likely not heal the best. You'll see ink fall out. It'll probably take a little bit longer to heal. It'll be an inconsistent heal. You'll see some color definitely fall out. I definitely go for telling people to moisturize because it's huge, prior and after, because without it your skin's dehydrated and it doesn't want to accept the ink underneath the skin. Because fun fact, if you didn't know, as soon as you get a tattoo, your body is trying to reject the ink, and it's in a perpetual state of trying to reject the ink, but it is just underneath the first layer of skin, so it can't reject the ink unless there's some sort of traumatic incident that causes a cut or something like that. That's why if you're on antibiotics after a tattoo, that kind of plays into why a stray heal could happen. Because your skin does not want that ink there.
Right.
So obviously, tattooing has been around for a long time because of what great qualities and the decorative outcome that people love.
Sure. That's really great. Thank you. I actually didn't even know. I mean, I knew about moisturizing afterwards. I did not know about prepping. And I think
Mhm.
that's a great thing to keep in mind. And I also, how long would someone, how typically, right? Because obviously, as you already said, every person's different, but how long does it typically take, for example, an areola tattoo to fully heal, where someone could, go in a swimming pool or the ocean or be out in the sun or like do things that would, potentially while it was still healing would best be avoided? Like how long? Because
Yeah.
I know I've had to plan for this in the past, or it's like, maybe you're going on vacation
Mhm.
and you don't necessarily want to get a tattoo, a few days before you're going to the beach for 2 weeks or something, right? Like you want to make sure that it has the opportunity to heal before you introduce it to any elements or anything like that. So how long do you
Absolutely.
recommend?
Okay, so 2 weeks usually, as long as the moisturizing regimen is kept up on, you'll see it's usually completely healed within 2 weeks, if not a little sooner. Some people just heal very well, and it's a little bit prior to 2 weeks, a little after 2 weeks, but I would say 2 weeks is that sweet spot, and you'll be able to comfortably go on about your daily life after that, or any excursions or vacations. Um, Sunblock is also great. Um,
Mhm.
as a little side note, the sun, although it doesn't seem like it can, over time, frequent sun exposure can really affect the tattoo, whether it's fully healed or not. What can happen is frequent sun exposure, it can lighten the ink a little bit. So underneath the skin, although you once had maybe like crisp, sharp tattoo lines or large areas of color that were shaded in, they can kind of dissipate under the skin. So it almost looks like the tattoo is a little more faded or has become lighter, slightly freckled out of appearance, if that makes sense. So sunscreen is an amazing aftercare regimen to keep up on, because if you are going to go through a tattoo, you want it to last as long as you can. So although it's hard to stay completely out of the sun, a little sunblock goes a long.
Right. And depending on where the tattoo is, if it's covered by clothing, you know, many people who might get areola tattoos are likely, I mean, some might be showing them off out in the sun on a beach, but many might also not be, right? I mean,
It's true.
I know I have some transgender friends, some transgender men who've had top surgery and had, areola tattoos.
Mm-hmm.
And of course, they're excited to take their tops off on the beach and show them off because they feel like the truest version of themselves.
Mm-hmm.
Whereas a woman who wasn't inclined to show off her chest bare might, before breast cancer, also might not do it after. But yeah, that's great about the sunscreen. There's a couple questions, and we're starting to get towards the end of our time. So I do want to make sure to get these questions in. And this one I'm very curious about too. I kind of have my own answer because of my own professional background and experience, but I'd like to know what you know about this. So someone asked, can you have a tattoo on arms with lymphedema? So if someone has, I would say twofold. One, if someone already has lymphedema in an arm or, you know, in an area after breast cancer, and or if someone is at risk of lymphedema. So this person was told to be very careful with her arms and that they can't even get vaccinations in the arms. And I don't know, it says arms, so I don't know if that means maybe there was cancer on both sides, but regardless. So if you know that someone has lymphedema in an area or an arm, what are you taught from the tattoo standpoint, you know, about lymphedema and what is okay and not okay?
So it's somewhere we have to be very careful of. It's a limb that's been through lymphedema is already immunocompromised, so there's a chance that it can't fight bacteria as well as someone with a better immune system. So I would err on the side of caution, obviously. I would ask this individual to get cleared by their doctor first, because I'm sure there are medications that they need to take and a few other factors that come into this. So as much as I wish I could say, yes, you can, that is it is an answer that I can't completely say yes to. But you could get a tattoo in a spot that's away from your lymphedema affected area. I feel like it's just on those areas that are the most at risk of possible infection. But remember, if you have lymphedema, your immune system is a little bit compromised already. And I'm not like the genius of all tattoo related questions or anything. I wish I could add more information. But I would say ask your doctor first. And it may be a yes because you have to be in a good spot in your healing.
Yeah. So I'm going to interject there. And actually, I mean, that's a great answer because obviously it sounds like, you know, your advice is err on the side of caution, right? And check in with your medical team. As a lymphedema therapist, I will chime in here with my own perspective on that. One is that, with asking doctors, and you might find this, I'm always in favor of asking your medical team anytime you're going to, you know, whether it's tattooing or doing something adventurous or, you know, taking on a new self-care routine. Like it's always a good idea to check with your medical team, and get their, you know, input on it. The one thing that I find as a massage therapist, even though I'm an oncology massage therapist, and this is where I have specialized training, is doctors, medical oncologists, surgeons, they don't always know as much about what we do. So just because a doctor says yes or no doesn't mean that yes or no is the final answer. You can always let it be that final answer, especially if you're taking a conservative approach. But I have had doctors say yes to situations that were hard no's because they didn't understand what was going to happen in that scenario. As a lymphedema therapist, I would advise that it is in your best interest to not get a tattoo on the arm where you have lymphedema or even are at risk of lymphedema. So if you have had breast cancer and you have had lymph nodes removed, even like a sentinel node biopsy, and or you've had radiation, or you have massive scarring, like truly traumatic scarring, say from surgery, all of those things can actually create a risk of lymphedema. And anything that creates an inflammatory response or potential source of infection can actually trigger a lymphedema flare-up. So for the person who asked the question, if you actually have lymphedema, I would not tattoo the most conservative place. I would not tattoo on your arm with lymphedema. From an even broader standpoint, when we're talking about lymphedema and the lymphatic system, we divide the body into quadrants. So we kind of, it's from like the belly button up. So from like the waist kind of up and down is like top half and lower half. And then from left to right is like down the midline, the nose, and down the belly button and the pubic bone. So left and right halves makes quadrants. And technically, your whole quadrant is at risk. So Evelyn, I don't know if you've had any experience with this, but I've seen a lot of beautiful tattoos on the chest and on the breast, whether a reconstructed breast or a breast that's had a lumpectomy, which typically involves radiation, and or maybe flat, someone who's chosen aesthetic flat closure and they've opted for tattoos. I think they're gorgeous. I love them. I'm not saying it's not a good idea, but if someone was my client and they were asking me, I would say avoid the entire quadrant that you have a lymphedema diagnosis or a lymphedema risk. So that means basically kind of collarbone, shoulder, chest, torso down to about the waist. This includes the back of the shoulder and the arm and hand. So for example, I have a risk of lymphedema. I had breast cancer on my right side. I had 6 lymph nodes removed for biopsy and sentinel node, for checking. I did not have radiation, but because of those 6 lymph nodes removed, I know I have a risk of lymphedema in this what we call upper right quadrant, breast cancer on the right side. I got 2 tattoos done. I got permission from my surgeon before my double mastectomy. And I had one on each. I got one here, like just kind of below the elbow, on each side. And I did that knowing that for me, that would be my last tattoo on this right quadrant. And there's just, there's such a risk of things like cellulitis, of flare-ups. I have seen people have lymphedema flare-ups from so many different kind of what seemingly innocuous or very benign things, like too much shoveling snow or raking leaves or whatever. So for my preference, given my experience in my field, I would say try to find somewhere else on your beautiful body to put a tattoo. But ultimately it is a personal call and you kind of have to decide from there. But that's the most conservative answer, is to try and find somewhere else.
I completely agree with that answer, and I would just elaborate. If you do choose to get a tattoo and you are at risk of lymphedema, you're not in an active state of that. That's truly a personal call, and I would recommend waiting until you feel healthy at the very least, where you're not feeling just under the weather all the time. You have your energy back. I would just wait until you feel close to as healthy as you can be before venturing into getting a tattoo, because a lot of trauma can be placed on the body after surgery, especially the breast cancer variety. So waiting a little bit, being patient, it goes a long way with maybe putting that final note on your story of getting the tattoo. Just wait till you feel healthy with that.
I will also say from kind of regarding lymphedema, I talked to another lymphatic therapist who I asked this question about. She felt pretty comfortable with areola tattoos, but would not recommend like decorative tattoos on the arm or the shoulder for someone who, anywhere there's a risk or an actual diagnosis. So another option is if you're not sure, talk to a lymphedema therapist. I offer virtual consultations, and I'm happy to answer questions like that. Most cancer centers, most oncology practices should be able to refer you to a lymphedema therapist that within their practice or associated that could answer questions like that. So that's where, with something specific like lymphedema, you want to go to the source. Those are the people you want to ask for to get their opinions, and then then you do with it what you will. But thank you. That was really great. That was such a good question. The person also said thank you very much, and she has trouble with both arms. and the quadrant information was enlightening. If this is the first time you've heard any of this regarding lymphedema, please talk to a lymphedema therapist, because that's a whole other topic for another learning series, but it is very important. I have one more question in the chat, and then we'll jump to any final questions before we wrap up. So someone wants to know, does it hurt, and how would you describe it, the sensation? So maybe for someone who's never had a tattoo.
Absolutely. So it does hurt, but every person has a different pain tolerance. So the closest that I personally can come up with is it's almost like a cat scratch, and or a brush burn. I was talking to a client the other day that described a tattoo to me like getting zapped, like a light electrocution, like one of those like old toys, you know, that you would find. And I thought that was a very accurate description as well. So it varies from person to person, but it's not unbearable. It's a little uncomfortable, but it isn't going to be the most painful thing you've ever experienced. There's also for people who are still hesitant about it, there are numbing creams available that can numb the skin. Obviously, these numbing creams have differing agents in them and ingredients, so obviously you would have to check to see if you are sensitive to any of them prior to use. But there's also, you can go that route of numbing your skin prior. And the opinion on numbing creams in the tattoo world is varying, but for what my experience, I feel like if it makes someone more comfortable, absolutely you can use numbing creams or numbing sprays. I feel when people are at ease, that makes for a more successful tattoo, even if a touch up may be needed. So don't feel like the pain should hold you, the idea of pain should hold you back, because if you have been, if you are a breast cancer survivor, if you are going through it right now, you have gone through so much that a tattoo, I feel like, would be nothing in comparison to some of the other things you may have gone through.
For most of us, that's probably true. I will say too, you know, as someone who's got, I think I've got like 11 tattoos. Granted, they're all smaller, but to me, it kind of feels like a mild bee sting. Like it's like a little bit of a buzz. Certain places sometimes are a little more sensitive than others. I will say too that if you're having, like, say, an areola tattoo done, or tattooing over scarred tissue, there's a good chance that you already have some loss of sensitivity. So like, I know personally, I have no sensation over the front of my breast where a tattoo would get placed. So if I was doing areolas, so I don't know, you know, I don't know how that would play in, but for a lot of us, there's probably already a little bit of a lack of sensation. And I think, you know, as far as numbing cream goes, certainly you would want to talk to your artist. And that's, again, this is where we get to like kind of always remind you, like, go back to the experts, right? So, you know, interviewing different artists, if you're thinking of doing this, is a great idea. You know, just like anything, you're allowed to get a second opinion. You know, should be allowed to see someone's body of work, right? Like Evelyn has shared pictures with us today. You want to make sure you, like, just like you said earlier, you want to make sure you feel comfortable with the person who's going to be doing this for you. And because not only is that going to make it a better experience, but it's most likely going to ensure that you get a better outcome as well. Evelyn, was there anything else in your presentation, or I just want to be mindful of our time. Was there anything else in your presentation that you wanted to make sure to highlight tonight, or did we hit all of the main points?
I truly believe we hit all the main points, and obviously, if I didn't elaborate enough on anything, more questions are welcome.
Yeah.
I can
Well,
ramble, and hopefully I was able to answer all the questions, because I know this is definitely an area of interest for a lot of people,
yeah.
as
Well,
fans of tattoos, or just wanting to regain a little bit of
yeah,
sense of who they were.
familiarity. Absolutely. We already had one comment that said this was wonderful. Thank you so much. And I do want to just offer up, are there any final questions? Does anyone want to drop a question in the chat or raise your hand use the little like feature that says raise hand on your screen if there's any final questions? So Evelyn, you practice at Nickel City Skin Spa, is that correct, in Snyder?
Yeah.
Okay, great.
I
So if
am.
someone wants to find you, is that the best place to reach you then?
Um, I'm excuse me. I'm there certain days of the week, so
Okay,
I would say the best way to contact me would be either email, or you can find me on Instagram or Facebook. On
great.
Instagram, I'm Evelyn B. Tattoos. And on Facebook, I'm Evelyn Bellreng. So I don't try to hide my name or anything. I try to be as accessible as possible. So
Okay,
I would say you just type my name into both Instagram or Facebook, and you can find me.
come
But
up.
email
And
is
we'll
also
be sure, yeah, we'll be sure to include your information with the recording notes on YouTube. And the other thing we'd love to do, oh, sorry, Miranda, was that you?
Yeah, I was gonna say we'll tag you on Facebook, we'll tag you on Instagram,
Perfect.
and then that way
Yep,
it'll be easy
yep.
to you. And if anyone had any questions that may come tonight at 3 in the morning, whatever, feel free to to email us, and then we'll put you in contact and we'll get those answered. So
Perfect. That's awesome.
yeah.
And we'll also work to get some literature, like either business cards or brochure, something from Evelyn for our resource wall. Because we've got, if you haven't been to our new location, our new headquarters at the United Way building in downtown Buffalo on Millionaires Row, we have a beautiful resource room and welcome room with a lot of literature and information from local businesses, artists, and organizations that are relevant to our community. So we'll make sure to have Evelyn's business cards there so that if you come in looking for this type of information, we can connect you. Okay. I think that's it. Evelyn, thank you so, so much for your time tonight, for your sharing your knowledge with us, for sharing your art with us. I'm always awed by the fact that, I think for a long time, like you said, tattoos have such a long and varied culture throughout history and throughout cultures. And in Western society, sometimes they kind of got like, they kind of had a certain perspective or perception about them. But most of the tattoo artists that I've met in my life are either natural artists who evolved into this work, or like you, have fine art degrees, and this just is your medium. And I think that's so amazing. So thank you for supporting our community. Thank you for helping to make people feel good in their bodies, find the familiarity that maybe they're seeking, or the next level of whatever that goal is that they want to express, how they want to express themselves, right? So thank you again so much.
Yeah,
I
thank you
think
for
that's,
having me.
you're welcome. Thank you. All right, everybody, I'm going to go ahead and sign us off. Miranda, thank you as always for setting this up and getting us
Of course.
all lined up.
Thank you.
And hope to see some folks at the day of renewal on Saturday. All right.
Absolutely.
Take
All
care,
right, have a good
everybody.
night.
Bye-bye. All right. I'm going to go ahead and sign off, guys. I'll see you later.
Yeah, bye.
All right. Bye-bye. Thanks, Evelyn.
Yeah, no problem. Thank you.